Awesome.
Today, I have the pleasure of meeting with Dr. Brew, Jamie Brew, out of St. Louis. Welcome to the show, Dr. Brew. How are you?
Thank you. I'm good. Thanks for having me. I'm excited to be here.
So currently you are a physical therapist. You just graduated last spring, correct?
Correct. Yes.
Okay. And so in your first year of being a physical therapist, right now you're currently working two different jobs. Your first job, your full-time private practice office is a outpatient orthopedic office, correct?
Correct.
All right. So let's talk a little bit about what an outpatient orthopedic physical therapist does.
Yeah. So we see a very large range of ages of people and of diagnoses. So I would say my youngest patient I've seen is 5 years old, and my oldest is in their 90s. So I really get the whole kind of span of the lifetime and what that kind of means. And so we basically see people either post-operatively, so after they've had surgery, whether it be a rotator cuff repair or a total knee replacement. And then we also see patients who just come in either with like chronic pain. So they've been dealing with, pain for a while, and their doctors are trying a few different methods to try to see how we can get their pain down, one of which being physical therapy. And then, our other kind of here and there patients that come in are just ones that, are struggling with doing some of their daily activities at home. Those are usually our older folks, and they just need some help in gaining the strength or gaining the balance to be able to kind of get back to their daily life without needing really any assistance. So we really see the whole gamut of things.
Okay. And so private practice and outpatient, you said outside of the hospital post-surgery. What would be the difference between the private practice versus like a part of a hospital?
Yeah, so difference is really just kind of like when you're within a hospital system, usually, your doctor sends you from that hospital system straight to their own outpatient kind of area. And so there's just that more direct line. And in outpatient with a hospital, you usually get a little bit more like one-on-one time. And in private practice, we do a little bit more higher volume. So we're working with a lot more patients at a time, and typically trying to make them, as independent as they can be with all of their things. And then us being there as a good basis of kind of guiding their rehab for them. So we see, rather than doctors, from one hospital setting, we see doctors from a lot of different areas. And then we kind of have the added effect of adding in marketing with our practice to make sure that, we have good relationships with the doctors, so that if they're sending patients to us, that we're giving them good results and making sure their patients are happy when they come back to see them.
Okay, cool. And so then your other part of your job that you do as needed, you work as a PRN at an acute care hospital?
Yes.
What do you do for that?
Yeah, so that's a totally different realm of physical therapy. That's all patients that are in the hospital for whatever they might be in for. Our biggest thing is trying to figure out, are these patients safe to go home after they leave the hospital, or do they need to be recommended to go to either a skilled nursing facility or like an inpatient rehab hospital? And so when I go, since I only go PRN, which is as needed, I go, 1 or 2 weekend days a month. I'm typically just seeing, new patient evaluation. So a patient who hasn't been seen by a physical therapist before, and trying to determine what their activity level is and how independent they are, and then making that recommendation for where they need to go after their acute care stay. Therapists that work there full time get a little bit more of like the treatment aspect of it. So they'll see some of these patients, multiple days while they're in the hospital at a time, to try to improve just their independence with everything and get them back on their feet, whether they're in the hospital for a surgery, or if they're in there for a stroke, or if they're in there for COVID or anything like that.
Right. Cool. So let's walk through, excuse me, a day in the life of, or a week in the life of a physical therapist on your side of physical therapy.
Yeah. So with my outpatient job, we work long days, Monday, Wednesday, Friday. We're working like 7 to 6 to kind of accommodate those patients that want to come in either before they start work or after work. And then Tuesdays and Thursdays, we each work, a half day to help accommodate those hours, but make sure that we're not working, some crazy amount of hours per week. And so on a typical day, we see within our clinic anywhere from like 80 to 90 patients total. And I work with other physical therapists, and then I also work with physical therapy assistants. And so basically the difference between that job is that physical therapists are the ones that see a new patient. We do the initial evaluation and determine kind of the plan of care for that patient. Mm-hmm. And then physical therapy assistants are there to help us kind of go on with those plans of care. So help the patient, get to the end of their care in that sense. So we kind of work both with, PTs and PTAs. Right. And we see, a few new patients every day, but then a lot of it is just seeing patients coming back for their, 2 to 3 visits a week and getting them back on their feet. And our goal is always, get these patients to 100% back to where they need to be so that they don't have to step back in our doors, again for another problem. So.
Absolutely. So people joke about benefits of a PE teacher or a health teacher. You get to play games all day long and have fun playing with kids and stuff. What are some of the benefits that you feel like being a physical therapist has for you personally?
Yeah, I mean, I'm a very outgoing and extroverted person. And so being in an outpatient clinic that is, has the volume that we do, I get to express, all of my extrovertedness and being able to talk with patients all day long, which is awesome. I'm not the kind of person that envisions myself sitting at a desk, kind of by myself the majority of the workday. So I get the opportunity to talk with a multitude of patients, learn a lot about, how they came to us and why they're there, what their goals are. And the other thing is I get to be on my feet like all day long. I come home from work like over 10,000 steps every day, which is a huge benefit for me because I'm not sitting at a desk and then having to come home from work and figuring out how am I going to get my steps in or get my workout in. So that's a huge benefit. And then just in the facility that I'm in specifically, we work as a team really well. And so getting that kind of teamwork aspect in a job that otherwise may be very, like just you and a patient is really beneficial to me.
Cool. That's really good. So you're originally from Grays Lake, Illinois. How did you make the transition and looking from, being in Illinois, middle Illinois, to looking at SLU for your education?
Yeah, so when I was looking at physical therapy schools, there is the option of either going to a school for an undergraduate degree, whether that be exercise science or kinesiology, and then applying into physical therapy school for another 3 years after that. Or there's the direct admit option, which is the way that I went, which is you apply in high school and you go 6 years straight, or maybe 6.5, depending on the program, right, all the way through to get your doctorate. And so my biggest thing was SLU was the one school that I applied to that was a direct admit program. And once I decided physical therapy is definitely for me, it was just the best decision that I could make to go down to St. Louis and pursue that direct admit program.
Cool. So in that direct admit program, you graduated in 2018 with your Bachelor's of Exercise Science. And then 2 years later with that 6-year straight program and 20 with your physical therapy. What does that program look like in terms of classes that you take or, length of hours and stuff like that?
Yeah, so basically the way that the 6-year program is we call it kind of a 3-in-3 program. So in the first 3 years, you're doing all of your undergraduate classes, all of the kind of general education classes. St. Louis University is a private Jesuit school, so we're required to do theology classes and philosophy classes, in addition to all the prerequisites for that like professional phase for physical therapy, which includes, biology and chemistry, right, physiology, exercise physiology, in those types of classes. And so the first, 3 years are mainly just any of those general education. Being a physical therapy major, we are required to have a minor as well. So I chose a minor in psychology, which some of the classes were already integrated into our curriculum. But I would say I was kind of able to do my schedule anywhere between like 12 to 17 credit hours per semester in those first 3 years. And then I also got the opportunity actually with SLU to study abroad. They basically build out a semester in the junior year, so like your last year of the undergrad essentially for physical therapy, so that it's either you take all electives or you get the opportunity to go abroad. So that was also a huge selling point for me. But then, those last 3 years is that professional phase. So all the physical therapy specific classes, learning how to test muscles in different ways and how to teach patients, how to walk with different assistive devices and going from there. And those are more like the 16 to 18 credit hours per semester moving forward, with a summer of classes included in that, and then a summer of clinicals included as well.
Okay. So then with that program, what were being able to study abroad and being able to have the direct admit, were there any other advantages within St. Louis or within SLU that helped develop your career for physical therapy?
Yeah, one of the things that not all schools offer, but is pretty prevalent with physical therapy schools is a gross anatomy course. So being able to dissect human cadavers, basically to help better learn like origins of muscles and how the body works. And so that's a huge plus, and that's one of the summers that we do. Which in those summers that we had to take, courses in St. Louis, we got to explore St. Louis a lot too, which was really awesome. It's St. Louis University is smack dab in the middle of the city. But there's a lot of cool kind of pockets of St. Louis that I don't think I otherwise really would have known about had I not come here. Yeah, that's a huge benefit. And then it just being a smaller school for me was a benefit. I felt like I could get more involved in more better, relationships with my professors kind of throughout, not as much undergrad, but more so in the graduate phase. Being a smaller school, you kind of get that opportunity a little bit better.
Yeah. So at the end of your 3 years, you had clinical rotations to do. You said you did 3 of those, one in Cincinnati, one in St. Louis, and one in Denver. Let's talk about those different clinicals and what experiences you gained from those.
Yeah, so with clinicals, they want you to have a good kind of expanse of seeing different aspects of physical therapy, because there are a lot of options for you, graduating with a physical therapy degree of what kinds of jobs you can do. So in Cincinnati, I worked in a hospital-based outpatient clinic, which I kind of touched on a little bit earlier, but I mainly went there because I have family there and wanted to be able to spend some time with them over the course of my clinicals. But it was also a really good kind of hospital system to get involved in. I got to learn a lot more about, their specific patient population, which is a little bit, just different everywhere that you go. And then in St. Louis, I did an acute care rotation with Barnes Jewish Hospital, which is a very big hospital in St. Louis. And that's kind of where I learned those skills that I'm now using at my PRN job. And then in Denver, I went with the Children's Hospital of Colorado. I did a sports medicine rotation. And so basically the point of all of these is just to gain experience with different patient diagnoses and also just gain some independence as a therapist. The first 2 rotations, our goal was, be able to manage about 50% of a typical caseload so that, we could do that, but still learn from our instructors. And then the last rotation that I did was more focused on, okay, can you manage 100% of a caseload? Are you prepared for graduating and being a physical therapist on your own? With my last rotation being in the spring of 2020, it did get cut a little bit short because of the pandemic. But I still feel like it helped me, prepare myself for what we didn't know was to come, in 2020 and getting a job. So yeah, the biggest thing is just kind of getting that expansive experience, learning different patient diagnoses, and then learning how to be confident and independent as a therapist.
Okay, that's pretty cool. What were some of the key takeaways that you kind of learned as going through those clinicals?
Yeah, biggest thing is confidence can really go a long way. We learn a lot in school, and it's hard to sometimes put it together. So those clinical, experiences are really the best way to, here's the knowledge that I learned in these 6 years of school that I did. How can I actually put it into practice? What does that mean when this diagnosis I learned about is actually affecting this patient? So just really key takeaways is just putting it all, together and learning that I do know a lot more than I think that I know when I'm working with patients. And also recognizing how, when I don't know something that I'm working with and how to go around that. If I don't know the answer to a patient's question, or if I don't know the next step in their care, that, there's the ability to talk with my clinical instructor so that I can better learn how to do that, independently once I become my own physical therapist.
Right. So let's talk a little bit about how you got into wanting to be a physical therapist. You said you applied to the direct program when you were in high school, so you kind of must have known at some point in high school that that's what you wanted to do. What led to that career development?
Yeah, so growing up, it's always kind of funny, but my mom always asked me to massage her feet or massage her shoulders and stuff. And she always told me that I had my Nana's hands, and my Nana was a physical therapist herself. And so that's kind of a cool, link for me that way. But I really did. I wanted to be a teacher growing up. And as, the decisions came up, I was like, there's nothing that I'm passionate about teaching specifically.
Right.
And when I learned more about physical therapy, a lot of my job is teaching patients about their body, the way that their body moves. And that specifically, I'm a lot more passionate about. So it was kind of a good way to link in, my ability to work with my hands, and then also teaching, people everything that they probably didn't otherwise know about their body and how to make themselves feel better. And so I actually went to physical therapy when I was a senior in high school. I had a knee injury during a cross-country race, went to physical therapy. I personally had a very bad experience in physical therapy. I didn't like it. I was an athlete. I wanted to get back on the course as fast as I could, and I felt like I was being so limited, which now I know, like, wow, obviously that they were doing the right thing. But I felt like I had a bad experience with my physical therapist personally. And I remember going home and telling my dad, like, I don't think I can do physical therapy anymore. And, he was like, don't make that therapist, make you change your mind, just be a better therapist than that one was for you. And so that really motivated me to continue through physical therapy. And I always told people in school too, it wasn't just one choice. I continued to choose physical therapy. The more that I learn about it, the more that I have experience with it, I just continue to choose that as a, profession and hopefully lifelong career for me.
Absolutely. Yeah, that's pretty fun to hear that kind of story and background. So as you're 1 year into being a physical therapist, what's something that you're most proud of either in school or in your profession?
Yeah, I would say, just looking back, I've been with my company now for 9 months. I've been, practicing for 9 months, and biggest thing I am proud of is just, being a competent physical therapist and forming these relationships with patients. I get a lot of really good feedback from my patients that, they say they can tell that I care. And like I had mentioned before, marketing is a big aspect of our job with, the doctors, and making sure that we're giving their patients good care. And we actually received, some referrals from one of the doctors that said, hey, I want this patient specifically to see Jamie, which was really cool for me because, I'm a new grad at my company, and I haven't seen a whole lot, in the long run, I haven't seen a whole lot of patients, but for this doctor to see, my patients coming back and having good results and him being happy with, the way that I'm treating patients, it was really awesome just that he's now wanting patients to come, back and see me. And so something just to build off of that is now it's like, okay, well, I want more doctors to know my name. I want more doctors to think that I'm doing a good job and that they put those patients in good hands.
Absolutely. That's pretty cool to be able to have that as a, just being in 9 months so far.
Yeah.
So professional development, I know there's a lot of professional development as a physical therapist that you have to do. What is some of the stuff that, personally that you like to learn about, or as personal development through the professional development that you do as a physical therapist?
Yeah. So one of the things I'm most interested in terms of just like patient care is I'm really interested in like the athletic population, and specifically like adolescents. So, my high school athletes that come in, either they tore their ACL or they just, have bumps and bruises on the field. That's something I'm really interested in, but we don't specify a lot while we're in school. And so one of the kind of development things I want to do is just more continuing education courses on that return to sport. How do we know that a patient's ready to go back to sport? So I've kind of been working with one of my patients specifically who's been getting some like functional testing done at another clinic, and then kind of bringing some of that information back to my company and saying, here's how we can better prepare our patients for that. So anything that I can do, honestly, to take courses to make sure that patients are ready to go back to whatever they want to go back to is important for me. And then one of the other things that I think is interesting, and it changes statewide what you can do within physical therapy. And in some states, you can say, hey, my shoulder hurts. I can walk into a physical therapist office and say, I'd like you to treat my shoulder. That would mean that state has direct access. And as in Missouri, we do not have direct access, which means a patient has to go in to their doctor first and then get a referral for physical therapy for us to be able to see them. And I think in some cases that's super important. But I think in other cases, if we have a patient who left 2 months ago and they left maybe a little prematurely and they're coming back for the exact same problem, it would be almost better access for them, that they shouldn't have to, then go back to see their doctor again, and just make it more accessible to more patients. So that's something I'm really interested in working with, is gaining direct access in the state of Missouri. I did a little bit of work with that when I was in school, but we've been unsuccessful in the past, and hopefully it's on the horizon in the next couple of years in Missouri.
Yeah, that'll be pretty cool. Is there anything that you regret not doing in school?
Yeah, I would say so. When I was in school, I worked a lot. Obviously, being in college, you have a lot of expenses to pay for and a lot of future expenses that you'll be paying for. And so I did a lot of kind of little odd jobs, but I always told myself that I didn't need to get a PT specific job because I was going to be a PT for the rest of my life. But part of me kind of wishes that I did work as like a tech or an aide at a PT clinic, just to get a little bit more of that experience. And it would be more kind of that, as clinical rotations brought everything together, if I was working as an aide, the same day that I learned about something and I saw that in the clinic, it would probably have just helped, benefit me further in moving into that transition of becoming a therapist. So I would say, yeah, maybe just looking into more PT specific jobs while I was in school.
Okay. Yeah, that makes a lot of sense. So looking at that, is there anything that you wish you would have knew in high school or early on in college that could help you with your career now?
I think one of the things that I did know was that, this option of this direct admit program, I would say, is really, I think a lot of people do wish that they had known about that. Because PT school is very competitive. So trying to get into, trying to work for 4 years in undergrad the best you can, get the best GPA you can, take the GRE and apply to grad school, it may not happen in your first year or your second year of applying to PT school. And so having the option of the direct program where as a senior in high school, I knew I was going to go all the way through as long as, I maintained my GPA and everything. That was really important. And then I think the other thing is just, if I could have more exposure to all of the avenues that physical therapy could lead me, prior to joining PT school, I think I went in with one idea of this is what I want to do, not knowing there are, 12 to, 100 different options that you can do with a physical therapy degree. So having a little bit more exposure to it maybe in high school would have been a little bit more beneficial for me.
Okay, cool. What do you have to score on the GRE to be able to get in?
I don't know because I did not have to take the GRE.
Yeah.
It would be really good, informational to look up, but I luckily don't have to know the answer to that question.
That's good. Yeah. I just thought it would be interesting. I'll definitely be sharing that in the show notes. What's a book that you think you would recommend for a high school or college student that's interested in getting their foot in the door for physical therapy?
Yeah, I think that one of the things is just reading about things that make humans feel like they're humans and understanding, what it means to actually have an impact on an individual's life. There's a book called Being Mortal. I might have to look up the author really quick. It's by Atul Gawande. And so I think that book, it really outlines just, what does it mean having patients that, or the older population that may be nearing the end of their life. Their goals may not be to, go on a walk every day or to be able to play outside. Their goals may simply to be, roll over in their bed so that they can sip on their water next to their bed. And so I think just the idea of us recognizing, yeah, people are mortal and everybody has different goals is kind of a cool thing to look at before getting into the profession, because I think a lot of the exposure that kids have is, that like athletic population or their friends going to PT for a knee injury, but not everybody is, experiencing that like high level or that almost like lower complexity. So that's an interesting one for me.
Yeah, absolutely. And then a product that you use on a daily basis that helps you with your job duties.
I am not sponsored, but TheraBand is like the best thing that we use. It's just a resistance band. We can use it for, hand patients, shoulder patients, knee patients, hip patients, back patients. We can use it for anything. It's something we use on a daily basis in our clinic. We probably go through it like crazy. But yeah, that's the thing that if Drew, you called me one day and were like, hey, I've got this problem going on, like, what should I do? Probably the best things that I can do without looking at, your shoulder or something specifically, being hours apart is I would say, let's get you a resistance band. Let's try some of these exercises. So that's one of the best things that we can use in our clinic right now.
Cool. Yeah. So looking at that, like you said, as a pretend client or patient, let's look at the patient experience coming into the office. Let's say they have coming back from ACL recovery. They walk in the door, they're, post-op for however long they need to be before they can start PT. Let's look at what that looks like as far as a patient walking through the door.
Yeah. So, well, they're probably crutching through the door in that case. But they, they're coming in, the first thing is always obviously all the paperwork and everything. They're meeting our front desk. But then I go out, I take a patient back. We have private patient rooms within our clinic because the clinic can be a little bit, overwhelming for a new patient. But first thing I do is I sit them down just in a chair even. I don't get them up on our treatment tables or anything right away. And I just ask them, what got you here? What happened? Why did you injure yourself? How have you been feeling since your surgery? And then what are your goals for physical therapy? And then a big part of it is just education. So outlining, what is their care going to look like? For an ACL patient who maybe plays soccer, they may not be going back to the soccer field for, 9 months. So telling them, what that's going to look like, what kinds of things we need to do in this first phase. So maybe these first 4 weeks, we need to work on weaning out of your crutches and making sure your knee bends, because afterwards your knee doesn't bend very well after surgery. And, kids think my knee's going to bend fine. And then they try to bend it and it gets to like 90 degrees and they have no idea, so that it's just educating patients a lot about, what this is going to look like. And then we just take a look at making sure that everything's healing well. Afterwards, the doctor will usually be the one to always take out the sutures and things like that. But we want to make sure that there's no complications or, any excess bleeding or anything like that. And then, taking a look at what their range of motion looks like. So, how is their knee bending? How is it straightening? Is it painful when we're going from one to the other? And then looking a little bit at their strength. So we'll kind of take a look at their opposite leg first and see, okay, what's your baseline? What do we need to get you back to? When they're that early post-op, we don't do any like resisted testing or anything because we already know it's going to hurt them and we already know that they're going to be weak. So then we just typically give a few exercises to start with. We want to get their quads working well again. So we'll do a little bit of like a Russian stimulation that we have that helps the muscles kind of come back. We do those, some heel slides, get that knee bending a little bit better. Teach them basically exercises that they can do on their own at home so that they're still, improving their symptoms between physical therapy sessions. And I think the biggest thing in that first visit is just education. I give them a little handout of their exercises that we tried that day and that I want them doing at home, and then kind of send them on their way at that point.
And then once they come back for their second visit, is that a week, 2 weeks later?
So usually with a, earlier post-op patient, we want them to come in a little bit more often. So they usually come for 2 to 3 visits per week. That way, they're getting the early movement. A lot of the problem, there's a lot of swelling within the joint after a surgery. So we want to make sure we can kind of decrease the swelling and getting them more used to just movement of the joint in itself. So it's usually, if I evaluate them on a Monday, they'll probably be back in the clinic by Wednesday.
Cool. And then let's talk about something. If you dislike blank, like a athletic trainer, if an athletic trainer dislikes feet, then being an athletic trainer is probably not for them. What is something for being a physical therapist?
I would just say, honestly, human interaction. If you can get past having human interaction, you'll probably be good to go. I personally have a fear of feet, but things have gotten a lot better since I've been a physical therapist. So I don't think you should totally put anything off the table if you don't like feet, because you'll work with them enough. You get that exposure to them that it'll be fine. But I would say you don't really have to do a whole lot with like wounds and stuff, other than if you want to do like an acute care kind of thing. So that's not really a big thing, but I would say, if you don't like just like general human interaction, probably not a good place for you.
Yeah, absolutely. And then the last question I have is, if you had a mantra or quote that you live by, what would you like to share with that?
Yeah, I would say, my mantra is kind of just like to be a lifelong learner. I think that, we go to 6 years of school and we're like, whoo, school's done. Let me be a PT. But there's still a lot that you're going to come out, from PT school not knowing. And it's important that you kind of put in the effort, put in the research to learn about the new tactics that are used in physical therapy, or learn about why an ACL shouldn't go back to sport, before 9 months or things like that. And then constantly putting that to use, just so that you can be, the best therapist for your patients. And I think that the more that you invest in yourself and the more that you invest in your own time and education, the better that you can be for your patients. And I think it definitely shows.
Absolutely. That's awesome. Well, thanks again for spending your time with us today on your morning off. And we really appreciate hearing your experience of graduating through the pandemic and getting a job in your first year. Thanks again for being here. We really appreciate it.
Yeah, thanks for having me, Drew. I appreciate it.